Hey, you guys, Dr. Nicole here, talking to you today about what is pudendal neuralgia. I wanted to give you a little bit of an overview of the condition and then also how pelvic floor physical therapy can help and how we can really start to quarterback your care. We have really excellent expertise in this area that can really help to decrease your symptoms. So, the definition of pudendal neuralgia is chronic pain along the path of the pudendal nerve. Neuralgia simply means nerve pain that worsens with sitting. And the presentation and severity of pudendal neuralgia can vary so much. And not any one patient with pudendal neuralgia has the exact same symptoms as another type of patient. So what I want to sort of go over today is my little philosophy on pudendal neuralgia, pudendal nerve irritation, pudendal nerve entrapment. I think there's a lot of confusion around these terms. And frankly, it can be really scary when you get on the internet and you're talking about pudendal neuralgia, because maybe that's what you've been diagnosed with by your physician. Then you go online and then there's confusion with whether or not your nerve is actually entrapped, because the symptom presentation is similar. However, entrapment usually is a little bit more severe and constant versus a neuralgia, which it can be severe also. So that's where it gets a little bit confusing. And then us physical therapists like to talk about it in terms of pudendal nerve irritation. And we don't sort of like to think about it in the true neuralgia sense unless you definitely have a nerve component generating that pain versus the muscle part. So here we go. We can think about it a little bit like a continuum. So this is what I like to tell my patients. If you have a continuum here where entrapment is all the way over here and mild pudendal nerve irritation, kind of like having just like a little bit of sciatica where it's like, that deep ache kind of maybe tingles down your leg a little bit. That is actually happening sort of in the area of the pudendal nerve, which happens to innervate some pretty sensitive structures, right? Which is why we'll go over this here in a second, but this is basically the innervation of the pudendal nerve, right? One of the branches is here, one of the branches is here, and then one of the branches is here. So you can have your pudendal nerve irritated and still be diagnosed with pudendal neuralgia, right? But really what we want to do as pelvic floor physical therapists is look at what is the actual generating cause of that nerve irritation. And a lot of times it's actually the pelvic floor muscles. So we'll go over a little bit of the anatomy here. But if these muscles are tight, spasmed, don't know how to turn off very well, or simply kind of on guard because they're perceiving a threat in that area, then the muscle tightening themselves can actually irritate the nerve, creating nerve pain. Now, remember, we're talking about a continuum here. So you can have mild symptoms of that, which is like sort of fluctuates, maybe varies in intensity, and then you can have increasing degrees of severity. Most of the time, at the point when you're going to the physician and being like, what in the world is going on with my pelvic floor area? I've had patients describe it to me like a hot burning poker, like a curling iron clamped onto their labia and is twisting and shoving up. Like there's a lot of descriptors, a lot of common foreign body object feelings in there, right? I had one patient come in that always described what his symptoms were. He actually didn't have a ton of nerve pain, but he always had a different size of a foreign body sensation. So he would come in and say, today it's a cherry tomato. Today it's a plum. Today it is a lemon. Today it's a grapefruit, right? So he had varying levels of how much foreign body sensation he felt in the rectum. So the descriptions can vary, right? And at that point, we're kind of starting to call it pudendal neuralgia, of which means your pudendal nerve is irritated, but we still don't know exactly why without doing an exam, right? So the pelvic floor muscles can be an irritant. Pressure, the way that you're sitting can be an irritant on those muscles. The way that you're exercising, the way that the body is sort of clamping down and guarding in that area. And then there can also be a nervous system response of making that nerve sort of give you danger signals but there's no actual damage itself to the nerve. And then your body gets all confused because you just start sending messages up that says, yes, there is a problem. And then your brain goes down and is like, no, there's not really any tissue damage, but like, I know there's something wrong. So then the signals get all haywire and they get hypersensitive. And then you perceive that as increased pain in the pudendal nerve area, which happens to be all in these sensitive structures. Then they can get triggered by anything that goes on here, right? Insertion of anything here, bowel movements, urethral pain, anything that's going to also be around here can now activate that system and make that brain, pelvic floor, pudendal nerve area just sort of go haywire. So that's where we get kind of into that neuralgia category. And then true pudendal nerve entrapment usually happens after a surgery. So you're usually like fine, and then boom, you have a surgery like I don't know, any type of gynecological surgery where you did not have any symptoms prior, and then boom, you have severe nerve pain in the area of the pudendal nerve. Most likely entrapments are caused usually by some sort of suture or some sort of actual, where, like the name says, like a true entrapment where it's like tacked down somewhere. There can be scar tissue that attaches there and sort of irritates the nerve to the point where there's really no way to get around that. Although your symptoms can decrease with entrapment as well, but it becomes a little bit more difficult because there's an actual external issue around that nerve. With the other two things on the continuum, the neuralgia and the irritation, there's not an actual like damage to that nerve, right? And in fact, if you look at some of the actual criteria for pudendal neuralgia, it's pain in the pudendal nerve pathway, which is the pudendal nerve has 3 branches. So it takes a windy road through the pelvis, starts actually out by where your piriformis is, and then it goes in between your piriformis and this muscle right here called your coccygeus. So that's an area where it can get kind of smushed. And then it sort of winds around, and ends up coming out right by where your sit bone is. And it has 3 major branches. And this can kind of explain the reason why we have all sorts of weird symptoms, and also the symptoms that change, right? So a lot of my patients are really freaked out and confused when, well, this time it was near my clitoral area and today it's near my rectum. Like, I don't understand why it's moving and changing. And that's because it has 3 different branches. So there can be an irritation before it branches, and then it just basically chooses to irritate on one of these branches and sends messages up to your brain that says like, oh, today it's the rectum, today it's the perineum, or today it's near the urethra. So sometimes there's no rhyme or reason, and that can be really frustrating for patients, but at least we have sort of a reason why anatomically. So there's a urethral and clitoral branch here. There's a perineal branch here, and there's a rectal branch here. And again, that's why each of those symptoms can be urinary, urethral, sexual. They can be perineal, which is usually like sitting and just like burning, throbbing, aching in this perineum area, or they can be rectal, which is either foreign body sensation in the rectum or pain with bowel movement and a lot of other rectal type symptoms. So nerve pain now, if you think about where this nerve goes, nerve pain is usually burning, sometimes aching, stinging, stabbing, itching is another nerve symptom. So a lot of my patients will actually say, like, I swear that there's an infection. They go, there's no infection, but it's that nerve that can get irritated that actually causes that itching sensation. Now, one of the criteria of pudendal neuralgia is that there's no actually what we call objective sensory loss, meaning if we take maybe a Q-tip and we actually go around, you actually can still feel touch, right? But nerve issue, we call that paresthesia. So you might have an altered sensation, but there's not true sensory loss. So, and that's just one of the diagnostic criteria for pudendal neuralgia. Worsened by sitting. We already talked about pain in the pathway of the pudendal nerve, which is the three-legged sign, which is the W. And the pain is, there's no actual nighttime pain. So most patients, once they can actually get to sleep, stay asleep unless we have another reason why you're getting woken up, and then they actually feel a little bit better in the morning because that area has now been offloaded. So a lot of times the pain worsens as the day goes on, and then if you can actually get to sleep, I know sleep is a complex issue with any sort of nerve pain or chronic pain, so that's a little bit of a caveat there. But technically, true pudendal neuralgia is where you don't actually get woken up by your pain. You can sleep pretty much okay, and you actually feel better in the morning. And then the last criteria is if you actually get a pudendal nerve block, an anesthetic block, which is an injection, the symptoms that you're describing will either go away completely or for a short time, or they will decrease significantly. So that's the technical criteria of pudendal neuralgia. But you can have pudendal nerve irritation as a component of pelvic floor muscle dysfunction, or what we call hypertonicity, and still exhibit some signs of pudendal nerve irritation that aren't actually exactly this criteria. And that's why going to a pelvic health physical therapist can be really important, because we can actually either vaginally or rectally, we can actually assess along the internal path of the pelvic floor or the pudendal nerve, and we can actually feel what areas specifically of these muscles are potentially irritating that nerve all the way back to where it starts to come out from these areas up in the sacrum. The diagnosis is made mostly by a physician with symptoms, but we can also tell a lot with and give you a physical therapy diagnosis, meaning what do we think from a muscle standpoint and from a nerve standpoint, what do we think is the symptom driver behind that pudendal nerve irritation? And we can also do a lot of functional things with you, like modify your sitting, and just look at all of the other things that can influence that pudendal nerve. Things like really tight hamstrings and tightness and fascial irritation around the gluteal fold or your butt crease, right? Tailbone issues can also drive some irritation around the pudendal nerve. So there's a lot more of a broad spectrum of things that a pelvic health physical therapist can actually look for versus just focusing on that nerve. We also want to figure out why that nerve is irritated in the first place and why the pelvic floor is irritated or tight in the first place as well. We also want to, as pelvic health physical therapists, help your entire nervous system calm down, because the interesting thing about the pudendal nerve, and it's unique in terms of it's one of the only peripheral nerves, meaning a nerve like that goes down your arm or down your leg. The pudendal nerve is a peripheral nerve, which means it goes to other things, but it's the only nerve in our whole bodies that's directly innervated by that fight, flight, freeze response. That's that sympathetic nervous system. Oh my gosh, I have anxiety. I hurt. There's a threat, right? So pain itself can upregulate your nervous system, and in turn can go down into that nerve and make all of those areas that we just talked about irritated, painful, and just overall really just sucky, to be quite frank. Again, pelvic health physical therapists can both help from the nervous system calming aspect and the musculoskeletal and neuromuscular aspect of your pelvic floor. Now, we can work really well with a pain management physician and start to coordinate injections in very strategic areas as well. We can help with starting to work with your healthcare provider to work with what medications might work best for you based on what we're seeing. Do we need to be recommending nerve medication to your doctor or muscle relaxant medication to the doctor based on what we feel the actual cause is of that nerve irritation? So It's multidisciplinary team is key here for pudendal neuralgia, and you need definitely a good physician that's used to treating chronic pelvic pain. We love for our patients to be working with a pain management physician so that we can make sure that everything is good to go on the medication front. And then a pelvic health physical therapist can really be a good adjunct to your medical team in order to actually functionally figure out what is going on with these pelvic floor muscles and why. Other really interesting alternative treatments for pudendal neuralgia can be had. We can help to coordinate that. And there's some dietary and nutritional things that can also be individualized for you to help to decrease your inflammation. And so I really just want to have this be a hopeful message to you that if you are suffering from pudendal neuralgia, pudendal nerve irritation, or even pudendal nerve entrapment, you can get to a pelvic health physical therapist that is well versed and experienced in treating chronic pelvic pain conditions. And we should be able to help you to figure out why that nerve is irritated in the first place. You know, pudendal neuralgia is just a descriptor of your symptoms, right? It's pain coming from your pudendal nerve. But that diagnosis by itself doesn't tell you why and what's driving that. And our physical therapist, specifically a pelvic health physical therapist, can really help for just symptom management, number one, and then also to figure out the driving factors in your specific case, your specific activity level of why that pudendal nerve is irritated in the first place. So I encourage you to seek out help with a pelvic health physical therapist. Reach out to our clinic if you need help finding one in your area, or if you're local to Orange County, we would love to have you come to the clinic as well. We do have remote consultation programs for people all over the United States and the world. And then we also actually have a pretty robust out-of-town program if you're having a hard time finding a skilled pelvic floor physical therapist in your area. So good luck and hang in there. And please, just get good quality information that's not going to produce a ton of fear and just pile on the stress of this diagnosis. Many, many, many patients can heal from pudendal neuralgia, and we want this to be a very hopeful message that if you can just find a pelvic floor physical therapist in your area or reach out to us if you need help, we can start you on the path of symptom resolution and healing. Have a good day.